Hi everybody, and thank you for joining me today on this webinar. I'd like to begin this session by thanking you for the important work that you're doing, both personally and as a trust, to protect health and save lives. Thank you. It'd be really useful if you could have a pen and paper handy whilst you watch this session, as I will be asking you to make some notes from time to time. We're going to look today at 5 key aspects: the emotional response of frontline workers to the COVID-19 crisis, opening conversations about mental health with colleagues in distress, the tread lightly model, where and how to signpost colleagues who need additional help, and looking after you. I'd like to ask you a question as we begin this session, and it'd help if you jot this down on paper. It's really important that we think for a moment about the experiences your colleagues will be having. So I'd like you to consider the ways in which this situation is likely to be affecting the NHS workers that you'll be supporting. Of course, some of these ways will be the same as everyone else, but there are going to be some specific ways that the NHS will be seeing and feeling this differently. So what do you think, folks? Perhaps you're thinking about the things they're going to see on a daily basis, or maybe you're thinking about how their expectations of themselves might affect them. An important predictor of stress and distress is the control that people have over their situations. How much control do they have over this? Hopefully you'll have jotted down at least a couple of things. So let's take a look at what might be going on for them. It's important to recognise that every single NHS worker is going to be experiencing some of these. But of course, others are going to be more specific to frontline hands-on healthcare staff. But first up is an awareness of the risk of infection. Even with the correct PPE, that's clearly much higher for anybody who's in close proximity with others, and it's going to be higher on the minds of many people. Many colleagues will also have to be giving difficult messages to people, whether that's telling them bad news about their health or enforcing the necessary social distancing rules for visitors. Even for people who are used to giving bad news, they may find themselves doing this a lot more than usual. While the guidance might be getting clearer, many people are still going to be dealing with at least some level of confusion, and that's likely to continue as the lockdown eases. And something that we're all feeling, but something which is particularly high as a rule in healthcare workers, is a feeling of powerlessness. This might be about the outcomes of the cases that they're working on, or simply a reaction to the whole situation. But that powerlessness combines with a sense of duty and responsibility that healthcare professionals feel towards their patients and society. And the combination of those two things can lead to feelings of guilt about unfortunate outcomes. We also need to recognise that healthcare workers as a whole are going to see a distorted picture of this pandemic due to the fact that they see people who are most affected by the illness. Faced with patients in critical care on a regular basis, it's easy to forget that the vast majority of people who contract this virus seem, at present, to have relatively mild symptoms. Workloads may also have increased substantially. Some people have been redeployed and are having to get used to a new job, and many people will also be reporting increased pressure at home. Maybe that's from caring responsibilities for children or older relatives. And finally, we need to be mindful that many colleagues will be experiencing grief. That may be through family loss, but also through the loss of patients or even colleagues. And all these factors combine into what our body perceives as a stressful situation. And it's important to recognise that that impact can come from one major event, a traumatic or critical incident, or it can come from the accumulation of repeated smaller stresses. And there's really good evolutionary reasons why stress does what it does in our bodies. But unfortunately, many of them are not very useful to us in our current situation. So let's take a quick whistle-stop tour of how this might show up in someone. It could be useful to ask people to consider how they are from 3 different points of view. Firstly, how's their thinking? Everybody reacts differently to a threat, so the most important measure is how they're feeling compared to their normal. Perhaps they're feeling lethargic or less energy for work or perhaps for home. They may be feeling anxious or agitated, and this can sometimes lead to erratic or uncharacteristic behaviour. Or maybe they feel sad or down, or perhaps have what many people call brain fog, unable to concentrate or focus. And that reaction may also show up in people's behaviour. Perhaps they're drinking or smoking more than they used to, or they may become withdrawn and not feel like joining in with others. Of course, it could also be quite the opposite, somebody who's usually fairly quiet becoming quite loud. Perhaps they'll notice that their performance has dropped, or they'll feel like they're not achieving what they normally would. And finally, it can show up in the body. Aches and pains can appear or become worse. Some people become intensely tired, whilst others feel unable to switch off and go to sleep. And because our digestive systems slow down when our body feels under stress, we may also notice issues like stomach pain, constipation, or diarrhea. So these 3 questions, how is your thinking, how are you behaving, and how's your body, can be really important indicators. They're much more useful than simply, how are you? Because so many people will just answer how are you with, I'm fine. Remember, the key thing here is that these are all compared to that person's experience of what's normal for them. So the next part of this session is going to be about creating the right environment to talk about how you feel. And I'm going to ask you to write something down again now, if I may, please. What do you think might be going through the mind of an NHS worker who feels the need to talk about how they feel? Take a moment now, if you would, to put yourself in their shoes. Perhaps you can consider how they might be feeling about themselves. Do you think they'll compare themselves to others? How clear do you think they'll be about their feelings? Do you think they'll have asked themselves the 3 questions I just mentioned? How's your thinking? How's your body? And how are you behaving? Will they be thinking about the past, about the future, about their jobs? Hopefully you've noted down something in that short time about how they may be feeling. Again, this is not an exhaustive list at all, but it can really help just to think for a moment how the person you're speaking to may be feeling. It can be really difficult to open up and accept that you need help, or even just honestly tell someone else how you're feeling. And it's really important to note that any such feelings are magnified by the stress response and the huge amount of change going on. One of the things people tend to do is compare themselves to others. They can often have preconceived ideas about how somebody should feel in a certain situation, and that can lead to them labelling themselves as abnormal. A perfectly natural reaction to this level of threat is to feel numb, as the mind tries to protect us from damaging emotions. But somebody who feels that way may take it as a sign that they've become insensitive or uncaring. And at the other end of the spectrum are people who think that because they are struggling with their feelings, that makes them weak or damaged in some way. And these feelings can be so intense that it's hard to make sense of them, and individual emotions are replaced by just a general feeling of being overwhelmed. And of course, we should also be aware that people seeking help for their feelings often delay due to concerns over how it will impact their job security, promotion prospects, things like that, if they ask for help. So now that we've examined the impact of this crisis on your colleagues and how they might be feeling, let's take a look at how we can create that safe environment and have an effective conversation with them. We call this approach tread lightly because it's really important to go through the stages and give people time to open up. It's also essential that you remember that your role here is to be a first point of contact and not the final solution to their situation. And that's important for you as well as them. You're not responsible for everything that person feels. And this is not intended to minimise what you're doing here. For many of your colleagues, just having that opportunity to think about and then talk about how they feel will be all they need. And by signposting them to the range of resources available, you can make a massive, massive difference. So again, I'd like to thank you for what you're going to do. A huge influence on somebody's feeling of psychological safety is the belief that they are valued. And this is relevant on a number of levels for your NHS colleagues. I really can't overemphasize the importance of this. Thanking someone is a simple, powerful gesture that lends validity to how they're feeling and to the act of asking for help. Firstly, we can thank them for their role in protecting and saving lives. Now, of course, this may come naturally when we're talking to doctors or nurses, healthcare assistants. But what about the back office and support staff, those who don't actually get involved hands-on with healthcare? Now, I'm sure you'd agree they're an integral part of the whole system. But remember, we talked about those comparisons people make. If they're comparing themselves to the people they see as the real heroes, you can understand why they might find it hard to accept that they're deserving of help. But they absolutely are, aren't they? And we can also thank them for raising their hand and asking for support, for talking to you. Again, this does not come easy, and a simple recognition of that can open up the conversation further. And we can remember to thank somebody when they've shared something personal. Again, not an easy thing to do, but the words, "thank you for sharing that with me," can help to give people the confidence that they matter and that it was the right thing to do. Next up, and closely related to the thanks, is reassuring your colleague. The point here is to think about what fears they may have about this conversation and how it's going to go. The effectiveness of the chat you have depends on them being open about how they're feeling and receptive to information about how they can be helped. And one of the things that's so important is that this situation is not normal for anyone. For everyone out there who's craving social contact outside work, there's another person who just wants a moment's peace and quiet. For everyone who finds it hard to get out of bed in the morning, there's another person desperate to switch off and get some downtime. The scale and nature of this crisis means that everybody is experiencing it differently. There is no normal. And this means there's no right or wrong way that people are feeling. Anger, sadness, overwhelm, fear, these are all perfectly understandable reactions to this situation. And whilst it's not okay that people are not okay, it most certainly is okay that they're experiencing this situation in that way. Another great line that I borrowed actually from mental health campaigner Jeff McDonald is, asking for help is not giving up. It's refusal to give up. And helping people to see that by seeking help, they're actually demonstrating strength, can help them feel safe in doing so. And having thanked your colleagues and reassured them that their reaction is perfectly natural, the next job is to explain to them what we intend to do and what we'll do with the information that they share with us. Now, we'll talk in a few moments about how to have the conversation with somebody we feel may be a risk to themselves or to others. But before we do, let's just look at how the overall conversation will run so that we can clearly articulate it to them. Now, exactly how you say this is up to you. I'm not going to attempt to script it for you. It needs to come across perfectly natural for you. But let's have a look at some of the things that you might like to say up front, right at the beginning of your. Now, it might seem obvious, but sharing a little bit of information with your colleague about yourself will help to build rapport, and that will allow them, in turn, to open up to you. And telling them why you're doing this role is another opportunity to show them how much they're valued. And next, you might like to briefly explain what you see the purpose of this chat is. This is a chance to be clear, this is a brief intervention, and that you're not here to provide psychological therapy. What you can and will do is listen, understand, care, and give information on the range of support available. It's also essential that we use this opportunity to make it very clear where we stand on confidentiality. For this to be a safe space, they have to know what information will be shared with others. Now, whether or not this conversation would be considered confidential in law is a bit of a grey area actually. But by making your position clear right at the beginning of the conversation, you can remove any uncertainty and you protect your colleague, and of course yourself and the trust. So have a think to yourself now, under what conditions might you breach confidentiality? Firstly, of course, you need to follow the trust guidelines about keeping data for any reporting purposes. You won't probably be asked to keep personal information about who you've been speaking to, but you may need to record the number of conversations you've had. But when I asked when you'd breach, you probably came up with something around people being a risk to themselves or other people. So let's examine that for a second. There's a widely held misconception that an intention to harm gives rise to a duty or a right to breach confidentiality. That's not actually the case. What that's referring to is called a public interest disclosure, and that would only actually occur if the person were in specific vulnerable groups, or perhaps if they intend to do something which would harm others. And apart from the legal issues, there's also a moral issue. And do you know, there are two equally valid opposite arguments here. Some people believe that people have the right to choose their own fate, and that it's morally wrong to intervene. Others feel that saving life is the only acceptable response. Both are defensible. It just so happens that I belong to the latter camp, and I would feel compelled to take action. And your trust may decide that they wish any disclosure of risk to be escalated as per guidance. So it's important we give the person absolute clarity about what to expect. And for that reason, I have a very clear and simple sentence that I use at the beginning of any chat like this, which makes very clear my intention, and therefore means I feel both morally and legally acceptable. So I just say, very simply, anything you say to me will be treated in confidence unless I feel I need to act to protect you or others. And saying that consistently helps me remember it, and it ensures that everyone has the same expectation from me. So folks, feel free to borrow that. So the final element, I guess, here is to explain from the outset what will happen when the chat is over. Now, of course, this does depend to a degree on what they tell you, but it's going to effectively fall into one of four categories. They may have just wanted to talk for a few minutes, and they may feel that that's it, that's fine, thank you, and no further actions needed. Or they may have decided on some actions that they can do to help themselves. They may have chosen to seek professional help through the SOS provision, or they may have agreed to accompany you to seek emergency assistance. So we can set up a safe space for colleagues to talk using the first three elements: thank, reassure, and explain. And you know, it's taken me a few minutes to go through them, but that setting up actually doesn't need to take more than a couple of minutes. But those couple of minutes are really well spent to help the conversation move forward. And once we've done that, the rest of the conversation is going to be naturally led by them, the individual. Our main aim here is to ask questions and to help them decide on the next steps, if indeed any are needed. And asking open questions is a great way to give the person the time and the space they need to process their thoughts and let you know what's going on. And often when we do this, we're simply providing an opportunity for that person to pause and reflect on what's going on for them. And as before, this needs to feel natural to you, so I wouldn't attempt to try and script it, but I will elaborate on some of the questions that you might ask. You've probably heard of open questions and closed questions, where closed questions are those that can be answered with a yes and a no, and open questions are all the others. In recent years, that definition's been refined a little bit, so that a closed question is one that can be answered with a single word or a short phrase. So, for example, asking me my date of birth would still be a closed question. Open questions are those that require the respondent to give additional detail, and they can be really impactful in this type of talk. So there are three types that might be of use here. Fact finders are used to ascertain the whats, the whens and the wheres of the experience that they're trying to relate to you. So an example might be, tell me about how you came to feel like this. Feeling finders are used to establish, I guess, the opinion of a respondent. And they're really useful, actually, as they help to protect us from projecting our own feelings onto them or assuming that other people perceive things in the same way. I mean, the old classic, which is still really useful, is how did that make you feel? And then we've got the thought provokers. And in a chat like this, They are perhaps the most powerful questions. So our thought-provoking open questions are the ones that require them to generate information and help them make decisions about how to proceed. They often begin with how. For example, how do you think you'd feel about talking to someone else in a bit more depth about this? Or how would you prefer to get help? Would it be in person, over the phone, or online? Whilst open questions tend to be useful for allowing the other person to respond fully, there's still a place for some closed questioning. So, for example, if the person you're helping seems to be struggling to open up or doesn't know what to say, it can actually really help them if you ask just a few general closed questions to which they can give very simple answers just to get the conversation flowing. Another time you might use closed questions is to confirm your understanding. So, might say something like, so does that mean you're feeling angry? Or to check specific facts about something. So, time for me to ask you another question, if I could please. And again, please jot the answer down if you're able to. I want you to imagine that you're talking to somebody who is at risk of harming themselves or maybe even harming others. What might be some of the, what we could call red flags, if you like, the words or the language or the phrases they use that might signal that intent to you? Are there certain words that you might hear? Or certain feelings that are associated with suicidal thinking? Apart from the total obvious, like I'm going to kill myself, are there any phrases that you might consider red flags and just be a little bit concerned about? So, what did you come up with? There's no definitive checklist, but certainly we should be concerned about people expressing any of the following in a conversation. So feelings of low worth or guilt, or people who express that they feel a burden to others. People who tell you they've been acting recklessly or feel out of control, or people who say that they feel trapped, or there's no way out. Any phrases that suggest overwhelm, such as I can't cope or I can't take this anymore. And then things which use what I call finite language, by which I mean things like this will all be over for me soon, or it won't matter to me this time next week. They are all red flags to me, which would make me concerned. Now, of course, the right time to take action is any time that something that person says gives you cause for concern. So let me ask you another very simple closed question. If you heard a red flag, something that left you worried, concerned about their safety, would you ever come out with it and ask somebody if they were considering suicide? Yes or no? If you said no, then you're not alone. Many people don't feel comfortable with the idea of asking this question. Why is that? It often comes down to one of two things. Firstly, there can be a fear that asking the question is opening a can of worms. I always say, actually, if you open a can of worms, there's a chance they'll live. Maybe it's a fear that it will put the idea into their head, or it's a worry about, well, what will I say if they say yes? Please let me set your mind at ease. There is substantial evidence that talking openly and directly about suicide, if anything, is likely to improve mental well-being and reduce suicide risk. You will not put the idea into someone's head. And whilst talking about suicide isn't easy, it is really important. And by following simple guidance, you can truly make a difference. Secondly, some people are concerned that if they ask that question, people could be offended or scared off by talking about suicide. And that's a reasonable fear. But I'm going to put this really simply. I would rather offend 100 people if it meant that I asked the question once at the right time. If someone's offended, I can simply apologise and tell them, I'm sorry, I only asked because I was concerned. So please, if you are concerned, ask the question. The guidance is simple. Ask directly. I use the phrase, have you been thinking of ending your life? And that can work if you prefer not to use the word suicide. Use non-judgmental language. So the phrase commit suicide suggests it's a crime. And then other people sometimes use phrases like, oh, you're not going to do anything stupid, are you? And that might be intended to kind of soften the edges and make it humorous. But to somebody who is considering suicide, that will feel disrespectful and belittling. Be compassionate, whatever their response, and whatever your personal feelings are about suicide. Some people have been known to help or to try to help by asking people, well, what do you think your families are going to go through? Trust me, they've thought of this. They've thought of nothing else. And if anything, that's only going to make them feel guilty. If the person says they've not had these feelings, then you can acknowledge that response, but remind them they can talk to somebody if that changes. Sometimes people need time to tell others, so leave the door open for future contact. Anybody who discloses suicidal thinking of any sort clearly needs support and help. But it's a really important next step to assess their level of risk and whether this is a fleeting thought or something that they've begun to plan or they think about lots. Around about 20% of people report considering suicide at some point, but most don't follow this through. But we should always treat it seriously. So the next question we must ask is to understand where they're up to in their thinking. And that's exactly what I say. I say, please, can I ask you, how far have those thoughts gone? Is that a general thought? Or have you actually started to plan out how you do it? We should also ask if they've already acted on these thoughts, for instance, by taking dangerous levels of medication. Somebody who's already caused harm to themselves should seek immediate medical attention. But if they haven't done that, our immediate priority is going to be to ensure that person is safe and receiving appropriate help. Somebody who's had fleeting thoughts of suicide and makes a solid plan to contact the steps of support services that evening might well be considered safe for now. Be honest. Ask them, do you feel that it's safe for you to leave here and go and do that? It's sensible to discuss what they'd do if they felt they were more at risk. Who would they call? Where would they feel safe? And it's a good idea as a plan to catch up to ensure they do follow through with that action. And in fact, the evidence suggests that this reduces recurrence rates. However, somebody who has begun to make a plan to end their life should be considered an immediate risk and really, ideally, should not be left alone. Our aim here is to help them make the choice to accept help. Sometimes that decision takes time. And if they're safe with you, i.e. they're not in physical danger right now, it's best to give them the space to make the decision themselves. Trying to rush it or absolutely trying to take action without their consent presents a risk of the person becoming aggressive or taking off and leaving the premises. Having a conversation that allows them to feel heard, to feel valued, and to feel they matter will usually slowly guide them to help. And remember, talking to you in the first place was a form of help-seeking behaviour. So let them guide the conversation and don't be afraid of a few moments of silence. Summarise what they've told you in neutral language so they know that you're listening. Telling somebody that whilst you don't know what they're going through, you care and you understand how real it is can be such a powerful and important thing to do. And from time to time, you should ask them again if they're now ready to seek professional help. But use your judgment as to when the right time is to ask that in a conversation without feeling like you're badgering them. So think back to the tread model. It actually becomes very, very relevant again after somebody says they've had suicidal intentions or thoughts, because we can thank them for sharing that information with us. It's not an easy thing to do. We can reassure them that we don't think any less of them for feeling like that, and that we care and we want to help. A phrase I find useful is, "Your life is important to me. Please, let me help you." We can explain that we're going to take the time to help them to plan the most suitable assistance for their situation. And if you are unable to remain with them, and you do feel the need to call for assistance, you should also be very clear about when and how that would happen. We can ask them if they felt like this before, and if they have, how did their feelings change for them? We might ask them about their reasons for dying and what reasons they have for living, and we can then focus the conversation more on those reasons that they give us for living. And when the person's ready to accept help, we can move on to D. The D stands for direct and refers to the final stage in this conversation, signposting that person to available support. And this stage is relevant whether the person we're talking to is experiencing mild distress or has disclosed suicidal intent, and everything in between. The difference is the urgency and whether or not we feel the need to remain with the person until they have specialist help. If you're in any doubt, just please seek consent from the person to share the conversation with your supervisor or another member of the team. So where can we direct people to? Well, we could split this into 3 categories. General medical services that are available to everybody, resources provided by the Trust, and resources external to the Trust. So please, folks, take some time to familiarise yourself with the resources that the Trust provides to support the well-being of your colleagues. For example, in work, there may be occupational health provision, an employee assistance programme, a 24/7 helpline if you have access to that, and also other apps and support that have been offered to people within the NHS. But for some people, self-help isn't suitable, and they might prefer to make a GP appointment, contact the Improved Access to Psychological Therapies or IAPT service, or visit a private counsellor. And please remember that someone you consider at risk of serious harm should be encouraged to visit A&E. And you could offer to accompany them. It can really help to have somebody there that can start the conversation and save them having to go through it all again. And that can also be a solution to somebody who wants to use, for example, a helpline, but doesn't want to call themselves. And others prefer to keep their personal and work life separate, and they'll respond better to suggestions of external agencies such as the Samaritans. And again, you could offer to make the initial call, and we've got Mind, Sane Line, and of course there's also Able Futures who are there to support people's mental health in the workplace. Your role is completed, folks, when you've helped somebody to feel valued, safe, empowered, and then signposted them to additional help if they need it. Please just remember, as you walk away from each conversation, you're just one piece in the jigsaw of their life. You don't have accountability or responsibility for all the other pieces. So the last thing I'm going to ask you to do is to take a look in the mirror and regularly check in with yourself. How are you doing? Of course, that's not a great question, is it? So how about asking, how's your body? How's your thinking? And how are you behaving? Folks, I'd like to finish with a very heartfelt thank you to each and every one of you for the work you do. Thank you and goodbye.